The radical hysterectomy is a pain that I've never felt in my life. I got I was in so much pain. And my mother and my best friend, they're so sweet. They came and they stayed with me in the hospital the whole time. And I actually kissed them. I told them that I loved them. And I told them goodbye because the pain was like just so unbearable. And I think that's the one time during my whole journey with this cancer life that I actually gave up. You know, I was just like, and it's not that I wanted to give up. I just felt like I couldn't hold on anymore because the pain was unbearable. There are lots of hormonal changes going on, and it's only been 2 years, so I'm really trying to get used to it. I have a lot of problems with my back, and it's just the aches and pains are slowly going away, but you know, you just take it one day at a time and you hope for the best, like maybe tomorrow it won't be as much pain as there was today. One thing that's important is to always tell the doctors when you have a pain, no matter how little it is. You know, it may just be a little prick or just a little tingling feeling or a sensation that you have somewhere. And I think it's just really important to let them know. They need to know when you feel pain so they can kind of, you know, chart that and see if it may be something else. Like mine ended up being, I had a blood clot, I had a fever, and I had these pains in my lower pelvic area that kept coming back. And, you know, just no matter how bad the pain gets, just really try to hold on because it'll be over soon. Because of the cancer history in my family that's crazy, now I'm worried about different cancers coming, and, you know, I try to get tested as much as possible. I write little notes to myself. I have Post-it notes everywhere at work, you know, at my office, at my home office. I have them at home, just anywhere I can put Post-it notes. I even have this little notepad that I keep in my car, and I try to keep my doctor appointments because if something is there, I want to catch it early because I think with my cervical cancer, in hindsight now, there were little signs, but I let them go. And maybe if I would have listened to my body a little earlier, I would have caught some of those things. Because that I had to have a hysterectomy and chemo and radiation, I won't be able to conceive my own children. I think being 25 and when your choice is taken away from you, it's really hard, and that's been the biggest challenge for me because even though it's 2 years later, I still can't really deal with the fact that I can't physically create life. There was a time when I would go into the mall and if I saw pregnant women or women with their children, I would become so emotionally distraught that I would just have to leave. There was a time when I couldn't even hold my own nephew because I would just look at him and it would just make me feel like I'll never have this experience. And you know, as I progress with the new me with cancer, you know, I know the different options and I know that somehow, some way, I'm meant to be a mother. My name is Tamika Felder. I'm 28 years old and I'm a cervical cancer survivor.